neck mass. The patient had come to the OPD for the diagnosis for this lump which was pulsatile in her neck. You can see this pulsatile mass and was due for a FNAC. On putting the probe, I could see a tubular channel crossing over the trachea. This white structure is the trachea, and on top of the trachea was the a arch. And the first thing which came to my mind was, is it a vascular channel? Abnormal vascular channel. The moment I put in color, it showed high velocity flows. On magnifying, I could see the gush of the blood in this and also could see multiple tortuous channels coming out from it. And on tracing it further, I could see that this channel was tortuous and arising from the ascending aorta, continuing as the arch, and there was a possibility that was a right-sided arch. But however, a echo was done and the possibility of right-sided arch was excluded. So here you could see the ascending aorta, you could see the right subclavian artery coming out from it. And on further going a little up, you could see also the right common carotid artery arising from the arch. On the left side, we could see the left common carotid and continuing of the left brachiocephalic artery. Now, what are the differential diagnoses of a pulsatile neck mass? It could be vascular, it could be non-vascular. If it is vascular, the causes could be aneurysms of the carotid, but they are at a higher level, aneurysms of brachiocephalic arteries, aneurysms of the arch, and abnormal elongation of the great vessels like cervical aortic arch. And the non-vascular causes could be lymph node, which are close to the carotid vessels, and carotid body tumors. So we came to the diagnosis of that it's a cervical aortic arch. Then cervical aortic arch is a rare congenital vascular anomaly in which the apex of the aortic arch lies just above or superior to the clavicle. The incidence is 1 in 10,000 live births. And mostly it is asymptomatic. The commonest presentation is a pulsatile neck mass. It can cause tracheal compression which can result in respiratory symptoms. It can also cause esophageal compression leading to dysphagia, and at times it can cause epitaxis. The signs are, other possible findings or signs can be, there could be blood pressure discrepancies in both the upper limbs. There is loss or decrease in femoral pulses, loss of contralateral upper limb pulses on compression of the pulsatile mass, and there could be cardiac murmurs. So the learning points from this is the cervical aortic arch is a rare vascular anomaly in which the apex of the aortic arch lies above the superior aspect of the clavicle. Cervical aortic arch is usually asymptomatic and mostly present due to presence of the pulsatile mass in the supraclavicular region, but it can be symptomatic due to tracheal and esophageal compression. The medical management is important in cervical aortic arch with an emphasis of controlling the cardiovascular risk of hypertension. The third and the fourth aortic arches are the most likely involved in pathogenesis of cervical aortic arch. Ultrasound may be useful adjunct prior to more definite imaging to help distinguish a vascular etiology from a non-vascular etiology. Thanks for watching.